Hello.
Hi.
My name is Kathy.
Hi.
I'm going to do a head, ears, eyes, nose, and throat exam on you today. Can you please tell me your name and date of birth?
Lexi Higley, 8/22/1994.
And I'm going to check your armband to make sure that that's correct, and it is. Okay, so first, I'm going to start out by looking at her head. And her head does look proportionate with her body, so it's normal cephalic. I'm just going to feel your head. Let me know if you have any pain anywhere. No pain anywhere when I'm, okay. I'm going to stop and I'm going to feel your temporal arteries. Any pain when I push? No? And then I'm going to have you open and close your jaw. Again, she's got a nice smooth movement. I'm going to palpate your sinuses. So I'm going to push on your head in a couple different spots. I just want you to tell me if you feel any pain when I do that, okay? Okay?
Nope.
Okay.
Nope.
I'm going to start out with your eyes. And I noted that they look symmetric. Your eyebrows and eyelashes are intact. I'm going to pull down on your eyelids. Your sclera is white. Your conjunctiva is clear. You don't have any discharge from your eyes that I can see. I don't see any swelling of the lids. I'm going to turn my little light on, and I'm going to shine the light in your eyes and check your pupils. Okay. So first, I'm going to do direct, and then consensual, and then direct, and consensual. And her pupils both constrict to direct and consensual light. I'm going to check your red reflex. I'm going to shine a light in your eye. Okay, so just look straight ahead for me. So remember, right, right, right. And red reflex is present. And then left, left, left. And it's present there also. Then I just want you to follow this with your eyes only, not your head. So make sure you pause laterally. I don't want to see this. Okay? Nice and slow. We're not running a race. I don't see any nystagmus. And then just follow it in with your eyes. Okay? And then I want you to focus on the back corner over there for me. And then when I put this in front of your eyes, I want you to look at it, okay? And her combination is present. So I can say perla. Then I'm going to look at your ears. Okay. Start over here. I'm going to look at this ear. Well, let's look and see if they are in the right position. So your pinna is in line with the outer canthus of your eye. This ear, I don't see anything, abnormal lesions on the skin. I'm just going to push on it. Any tenderness anywhere when I push? Looks like she has a piercing in her ears. I don't have anything in it right now. I don't see any drainage from her external canal. And then I'm going to use my left, left, left. I'm going to pull up and out. She's got easy ears to look in. You hardly even have to try real hard. Did you have your infections when you were a kid?
Or, well, maybe one or two. But my brother had them a lot.
Okay. She's got a little whiteness behind this tympanic membrane. I don't know, maybe there's a little fluid back there. But otherwise, it looks shiny gray, and the cone of light is at 7 o'clock. And then I'm going to do left, left, left. Any pain or tenderness when I push. And I don't see any lesions and nothing from her external canal. She has piercing over here, too. And this one is pearly gray. Cone of light is at 5 o'clock. Okay. Nose is midline. She's got some freckles on her nose. Her septum is not deviated. I'm going to look at your nose. Oh, wow. Yeah, like a scab on your turbinate here. Are you snotty? Yeah? That's probably why your ear looks like that, I bet. Okay, was your nose bleeding?
Like last week.
Okay.
Yeah, from blowing it too much from allergies.
Okay. So you have a scab on this turbinate here. It's kind of swollen. It does look more pale than red. I don't see any lesions in that one. Looks like this side's worse. Okay. So that's her nose. And we're going to do your mouth. And your lips look moist. I don't see any cracks or lesions anywhere. Let's take a look at your teeth here. She's got a retainer on the bottom there. Her teeth are nice and straight and white, and her gums are pink and stippled. Give me a big, just open up your mouth for me. And her buccal mucosa is moist and pink. I don't see any lesions. I'm gonna have you look up for me. Hard palate is white with rugae. And I'm gonna have you stick out your tongue. It's midline. And then say ah. And uvula and soft palate rise with ah. Lift up your tongue. There you go. I don't see any lesions underneath the tongue. And then stick out your tongue one more time. Can you do me an ah again?
Ah.
Okay. I'm just gonna push down a little bit. She's got one tongue that doesn't want to relax. Say ah.
Ah.
Stick your tongue well.
Ah.
There you go. So her tonsils are like 1+. It's hard to see them, but they're 1+. They are there. They're present. They didn't have any exudate. I didn't see any drainage in her posterior pharynx. I'm going to have you look way up at the ceiling for me, and then touch your chin to your chest. Good. And then look at me, and look over your left shoulder, and then over your right shoulder, and then look straight ahead and touch your ear to your shoulder, and other ear to the shoulder. And her neck range of motion is full and intact. And then I'm going to do lymph nodes. I'm going to just kind of feel in a couple spots. So preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and then hunch your shoulders up for me. Supraclavicular. And I did feel no lymphadenopathy. I forget stuff.
Just her facial expression. Do you have to, because on here it says it.
Her facial expression is appropriate for the scenario.
Okay. I didn't know if that was.
Do we
Yeah.
do carotid arteries as well?
I don't think we have to do that, do we?
No.
No.
Did you check
Carotid
sinuses?
arteries.
Yep, I did sinuses. Oh, do you have to? I don't know why that's on there. We don't have to do carotids for this one.
Okay.
No,
Oh, yeah.
Very bottom.
I did that.
Okay.
But it says there.
Did I miss anything
Well,
else?
it's just a repeat. You have to understand it might be a repeat. It's all in this area, general
Yeah.
vicinity.
Yeah.
I mean, will you get it wrong if you don't do it?
No. And you won't get it wrong if you do it. Anything else? Okay, thanks a lot for being my volunteer, and I'm gonna wash my hands. Okay,
get it,
quick
though?
review of how to
Okay,
use
good.
these things one more time.